Stay at home and protect lives. That's the clear warning from the Health Secretary, Matt Hancock, who says it's not a request, but an instruction to the British people to beat the coronavirus. With warm weather expected this weekend, he says any relaxation of social distancing rules will mean more people will die. In the UK, the number of dead has risen by 684 in one 24-hour period. That brings the total number of deaths in hospitals from the disease to 3,605. Now, that number, however, doesn't include deaths in the community or in care homes and is in line, sadly, with scientific predictions. Today, 2 nurses lost their lives to the virus, with each leaving behind 3 children. Here's our health editor, Hugh Pym.
Amy O'Rourke, one of 2 nurses who've lost their lives to COVID-19. Tributes were paid today to their bravery, including at the Downing Street press conference, and there was this warning to the public from the Health Secretary.
We cannot relax our discipline now. If we do, people will die. So I end with the advice that we all know. This advice is not a request. It is an instruction. Stay at home, protect lives, and then you will be doing your part.
Hi folks, quick update.
It was the same message from Boris Johnson, still in self-isolation.
Although I'm feeling better and I've done my 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and everybody may be getting a bit stir crazy, and there may be just a temptation to get out there, hang out, and start to break the regulations. And I just urge you not to do that.
Earlier, there was an unusual official opening of the newest NHS hospital, the key players keeping their distance at fixed points, the moment marked by a royal video contribution.
Perhaps I could invite Nightingale's head of nursing, Natalie Gray, on my behalf to unveil the plaque to declare NHS Nightingale Hospital open.
In less than 2 weeks, huge empty exhibition halls have been transformed into specialist hospital wards for COVID-19 patients. The hospital is ready for new patients. It had been thought the first group would have arrived by today, but London's hospitals have built up enough extra capacity to cope with the caseload at this stage. So the Nightingale won't be needed till next week.
Good, and I'm glad to see that you've got the protective equipment.
Getting things done is the message the government wants to convey, but Matt Hancock, meeting staff in training at the Nightingale, has faced claims he hasn't done enough on testing for the virus. Having set a target of 25,000 tests a day, which slipped to later this month, he's now come up with a hugely increased figure of 100,000 by the end of April, including many more done by academic and industrial laboratories. Where are the tests going to come from? Who's going to do them? It just really hasn't been explained. You haven't given any detail.
Well, we have. I set out a 5-point plan yesterday. The first stage is the expansion of the testing capacity within the NHS and with Public Health England, who are doing an amazing job. And then also the next stage is to bring in the private sector companies, the existing testing companies.
Testing NHS staff helps get more of them back to work quickly. The Scottish Government is increasing facilities like this.
This expansion of testing capacity means, amongst other things, that we will be able to test more key workers with every day that passes. However, in addition to increasing capacity within NHS Scotland, we are also working with the UK Government and other partners to further increase testing capacity beyond that.
The NHS needs all the protective clothing and ventilators it can get, and 350,000 items arrived from Shanghai today, Virgin Atlantic working with Guy's and St Thomas Hospital Trust. There was a virtual graduation ceremony for doctors at the University of Bristol today. It happened early so they could move straight to the NHS front line, where they'll certainly be needed in the months ahead. Hugh Pym, BBC News.
Well, as we've been hearing, Boris Johnson is also urging people to stay at home this weekend as forecasters predict good weather. Our chief political correspondent, Vicki is at Westminster Forest tonight. Vicki, Boris Johnson was due to end social isolation yesterday. What happened?
Well, Clive, it's been obvious, hasn't it, from some of the photos and some of the video footage this week that the Prime Minister has not been well. And of course, at a time of national crisis, you do want your top team firing on all cylinders. And just look at the list, not just the Prime Minister, but his most senior advisor, the Health Secretary until earlier in the week, the Chief Medical Officer, all self-isolating. And there's no doubt that makes the task much harder. And I think it has shown at times this week when you needed people with a real grasp of the detail. They simply weren't there. Now, Downing Street insisting the Prime Minister does have mild symptoms. He has continued to work. He is chairing meetings throughout the day. And as we saw today as well, very keen to get those key messages out ahead of the weekend, saying to people like him, stay at home to save lives. The Prime Minister, of course, preparing to go into his 9th day in isolation.
OK, Vicki, thanks. Vicki Young there at Westminster. Well, key workers in all sectors are facing enormous difficulties in dealing with the coronavirus outbreak, none more so, of course, than frontline NHS staff. Our health correspondent, Catherine Burns, is keeping in touch with some of the men and women battling the pandemic and asked one intensive care consultant to keep a video diary.
This comes from the front line in the fight against coronavirus. Joy Halliday is an intensive care consultant looking after some of the very sickest patients. She started her video before a night shift.
I've got 3 children and they're all bath fed and watered, just waiting for my husband to arrive home, who's a GP and obviously busy, very busy at work as well at the moment. So we're a bit like ships in the night. Good evening again. It's now 9 o'clock and we've finished our intensive care handover. My trainee's with me, so we've got Johnny, who's our SHO for the night, and Stephen, registrar. Hello. And then another Stephen who's restocking our intubation trolley as we speak. So we are now going to go and don our PPE so we can start a ward round, and we'll take you with us for that. So here we are ready to start our ward round. We're outside of ITU at the moment. Johnny and myself are ready to go in PPE and Stephen is about to don his.
Joy and her team have to wear PPE, personal protective equipment, that offers the fullest possible cover. All the patients they see on this night have coronavirus and are unconscious on breathing machines. They have to get very close to them.
And that is us done, so we're going to start our ward round for the evening. I will leave my phone outside so that we do not bring it in with us, and we will touch base with you again later. So it's now 5:20 in the morning and we've had a really busy night here in intensive care. The nursing staff and doctors have worked non-stop. And it's really important that we look after ourselves as well as our patients. Sadly, there's some battles that we're not going to win.
The team try not to phone families overnight, but they have to call if they think a patient is about to die. But even then, relatives can't come here for their own safety.
At these times, normally families would be present in intensive care all the time by their loved ones' sides. And with the visiting rules being changed, and the risk to relatives coming in and catching coronavirus themselves, we don't have visitors anymore. And we're therefore providing relatives with daily updates about their loved one. We all know in NHS as healthcare workers that these are unprecedented times. We also know that there may come a time where we start looking after people we know, colleagues we work with, and we need to be prepared to manage this.
Joy Halliday there ending that report.